So I'm actually quite proud to say that I've been in therapy on and off for the past 10 years. I put myself in therapy when I had my first child back in 2008. Just kind of wanted to clear up anything that might be residual from childhood or college and other similar traumatic events. I think there's a misconception that people who go to therapy are really messed up, or that you have to be really messed up to go to therapy. So what do you think of that?
I have just seen so many people positively affected by therapy. A good therapist will find you where you are and help bring out, the best qualities in you.
There does seem to be a little bit of a stigma around it, but I agree with you. I think that for people who find somebody who can talk to that is trained in behavior and psychological processes, it can be very, very beneficial. Just understanding how the brain works and how we're wired to react in certain ways, understanding what defense mechanisms are and how they work and how you're protecting the body, and then how to overcome them because they can be limiting, is really, really powerful.
Men wait too long often to get help for both for all mental and physical health problems. And then, so then by the time they actually get help, they usually need like more intensive treatment. We tend to observe that men tend to have more like substance abuse issues or alcohol issues, and also anger.
I was going to say anger,
and aggression, whereas among women it's maybe a little more like depression, sadness,
or shutting down instead of acting out. A friend of mine recommended a therapist who was not available. So I went with the next best guy. And my first tip would be always stick with your word of mouth referral.
You want to choose a therapist that you're most likely to go to. And so if you know that would be someone near your work, then you want to choose one near your work. If you know that's near your home, then you want to choose one near your home. If you know that it's someone who is a person of color, and if you're a person of color, then make sure it's a person of color. It actually might be useful for you to really think that through, because it's not always obvious the kind of things that you need. If, say, it's a male client and they actually have some, ongoing issues communicating with women, and if they're heterosexual, then they might actually want to choose a female therapist to work through some of those issues. Psychotherapist is someone who uses psychology or psychological methods to conduct therapy with the client, and that could be people who have lots of different degrees. In California, we see a lot of MFTs, or marriage and family therapists. Also, there are licensed counselors. In other states, we have psychologists, is another category. And a psychologist is someone, in California, it's actually very specific. It's someone who has a PhD in psychology. And you can't be a psychologist and not have a PhD. MFTs or licensed counselors, they sometimes will have more hours of experience seeing patients. And so in some ways the psychologist or the PhD has more, a combination of research experience and clinical. More knowledge maybe. They can teach in a university or do research. But in terms of if you're just looking for someone to provide therapy, then an MFT or other types of counselors can be absolutely great.
Well, let me ask you this. What the hell is a life coach? Like, truly, what is it?
I know that there are some coaching certifications, like health coach. I'm not super familiar with what they are. It's not the same thing, I know that, as a clinician who has a board to report to.
Correct. If you're looking for a relationship counselor or a relationship therapist or marriage therapist, you should ask them about their private life, because I suppose it makes sense. If you're giving somebody advice on how to keep a marriage together, have you managed to keep your own marriage together, is a question. What do you think of that?
These are all really good questions.
I'm fabulous that way.
And
it's what I do, darling.
I don't agree with that, I guess. And here's why. What about a football coach that wasn't a great football player. The studies say if you have a good bond, then it tends to work pretty well.
The thing with therapy, if you truly want to do the work, you have to find somebody who can call you on your BS. And this woman could do that. There was nothing getting past her, except for the time when she fell asleep on me. And that was awkward. I will say though that with therapy, that is often the case. You have to give it a few goes before you decide yay or nay, because it takes you and the therapist a little bit of time to kind of settle into the relationship. So maybe it's like dating. And by date 4 with this one, I was like, all right, it's not working. You're not getting in my pants. I'm not getting in yours. Let's get out of here. Yeah.
Your first at least 2 sessions are usually very different than the rest of therapy, where we need to ask a lot of questions and find a little bit more about what the problem is. I tell my clients, for example, you wouldn't want a surgeon operating on someone without knowing what the problem was. So why would you want a psychologist jumping in to solve something before they know what it is? So I do think it's important to work with someone who is trained. There are people who are good at motivating us, just athletic coaches or a friend just to listen to what's going on. Definitely a place for those. But when you get to something that there are certain issues that come up that the average person might not have the training to deal with that. And in some cases, especially with really strong emotions, it can be dicey.
Everybody's got baggage, and as we get older, we're packing in more and more into those suitcases. So I think it's very, very worthwhile to find somebody objective outside your home who is, of course, trained and can connect with you to kind of help you out, because I think it's tough. It's a tough burden for family members to bear even. It's too much and it's too close. And it's nice to draw back and have somebody who's not so directly vested in your decisions to help you think through things. I don't feel equipped, and I don't feel it's fair. So my first point is, what does your therapist say? Or have you been to therapy? Have you been going to therapy?
Sometimes there are times when you need to move past something that's been traumatic for you, and you need tools to help do that. And a good friend or someone who means well might kind of
not have access
to it or not know what to do, and you might actually end up either staying in a place, like a dark place, too long, or potentially it could make things worse. There's definitely a time and a place for medications, and some people have been immensely helped by medications. At the same time, again, I told you I teach a class in the healthcare system. There are some very serious incentives that the pharmaceutical industry has to try to sell their product. It's a product.
And of course it is.
I definitely think that some people can really benefit from that, especially like you said, for that really severe depression where you can't even engage in psychotherapy. That some medication can be really powerful. If they find that a medication doesn't work for them, that might be perfectly normal because of individual differences. A medication might work really well for you, and it might work really bad for me. That's just individual differences.
And that's really hard because you have to stick it out for a little while the medication kicks in. And I know this again because I have friends who have tried different drugs, and you have to wait, and it's really uncomfortable during that time if it's not suiting you.
And sometimes people blame themselves, or they say, there's no way I could possibly get better. But it usually requires you to just try different tools. It's great to hear you say how, talk about your own experience.
I could do 10 shitty things my therapist said, and that would be, trust me, there have been some fun experiences. Do the work. You can show up to a therapist and sit in the chair and not be willing to reflect and not be willing to grow. And then that's just a waste of your time. So consider this an investment in yourself and really dig into the recesses and make room for change and evolution, because that's what it's all about. This is Kaamna from KaamnaLive, and this is your destination for BS-free conversations about all the things you care about. If you liked what you saw, give us a thumbs up, and don't forget to subscribe to the channel, potter around and see what else we have here, and of course, tell your friends. Cheers.